कौन कौच ना कोठी कहल देखिए कौन करी ଆଉ ଚିନ୍ଚି ମୁଁ କହିବି ନିଆ ଚାବି ମୁଦି ନେଇକି ଦବ ମୁଁ ପାରିବିନି ମୁଁ ପାରିବିନି
Good afternoon, everyone, and thank you for joining us today. It's my pleasure to welcome you to important session on autism spectrum. We are honored to have our Dr. Shruti Mishra, a developmental pediatrics with extensive experience. Today, we'll be sharing a valuable insights. Hi, ma'am. Good afternoon.
Good afternoon. Thank you so much for the introduction. Am I audible and visible?
Yes, ma'am. You are audible and you are visible.
So thank you everyone for joining us in this afternoon. I know Saturdays are like a day to relax and all, but I think this is the best time we could gather together this in month of April, in which we could discuss more about autism awareness and specifically how as a parent we can work on children with neurodiversity. So first I will share my slide and let's start. At the end of the session, I have specific 15 to 20 minutes in which we will be taking questions. You can put your questions in the chat box also, or otherwise if you can feel free to discuss it online also as at the end of the session. Okay, so just give me 2 minutes. Okay, I think it's visible.
Yes, ma'am, it is possible.
Sure. So basically today we are going to discuss about how as a parent we will be able to work with our child. So it can be in conjugation with a therapist when with a parent act as a co-therapist, or it can be as a parent only and as a so, as a trainer, we can work with the child in which we are being trained and supervised by a therapist, and we go on working with the child. Okay, so first, what is parent mediated interventions? So, it is a structured approach where parents receive training to implement therapeutic strategies. So, what may be the help, like, what are the advantages of it? So, it helps in generalization, and we are working on communication skills, we are working on behavioral management, and definitely it is because the parents are the one who will be there with the child throughout the day, so there is a continuous inputs that we as a parent are giving to the child. Thirdly, it helps in definitely reducing the therapy cost and improves accessibility, and the parents who stay far away from a center, there is not much skilled professionals to work with the child. It is a boon when we are training the parent to work as a therapist. So coming on to the core components, so, what are the areas that we as a parent can work on a child with autism? So, first thing first is communication skill. When we start working with the child, what is the main thing that we are targeting? It's independence. So, when we talk about communication, I am only not talking about non-verbal or verbal communication. It is a way which the child can express their feelings, their wants, their needs, everything. So it can be in any mode. It can be verbal, non-verbal, via use of AAC, it can be unaided or a high-tech AAC, but I want the child to be able to express their needs, their interests, share their feelings, everything. So that is how the communication skills work. Next is social interaction. So having the child social interaction age appropriately. So for a toddler or a preschooler, it can be turn taking, it can be teaching engagement. Behavioral strategies, definitely managing maladaptive behavior and how to work with it effectively. Daily routines, independence in activities of daily living is the first and foremost thing that we have to target when we are working with the child, be it an early intervention setup, be it a parent mediated intervention. And lastly, we will be definitely discussing about some sensory diets, some sensory strategies. So when I'm starting to talk, I assume that parents know these basic terminologies. If not, please feel free to ask at the end. I'll be able to clarify it definitely. But I just wanted to have this discussion today basically on what the parents can do. And I'm not going to discuss about what it autism, what are the causes, because I'm assuming that when you are coming to these sessions, definitely there has been discussions, you know a lot about it, you must have read about it a lot. Okay, so will be focusing today only on the intervention strategies as a parent, which we can implement it at home. Now, third, coming to steps for implementing a parent mediated intervention. Suppose a child has received a diagnosis of autism spectrum disorder, or maybe he is in the process and there are some early risk factors. So, first of all, as a pediatrician, as a developmental pediatrician, I'm not going to wait and watch. First and foremost thing is that I am going to send the child for early interventions, and then side by side we can do more evaluation to understand the child's strength and deficits, which is a part of development assessment that we do, because we need to set the goal for training, because there's so much of things to teach. We don't know over a period of time whether the child is progressing or not, and is there any improvement, where the child is stagnant and not improving. So always a goal based intervention is what we target as. So we do a basic development assessment irrespective whether the child has achieved a diagnosis or not. If there is a lag, if there is a delay, I will go for a development assessment. We do a goal setting. Now, based upon the goal setting, we set the goal in all the previous area that we have discussed: communication skills, social skills, cognition, activities of daily living, imitation, and then we train the parents on how to engage on those things. Okay, and definitely daily practice is one of the most important thing, what we call it as an incidental teaching. So if there is an opportunity of teaching throughout the day, we will be using that as a part of incidental teaching. And lastly is monitoring. So you yourself as a parent, along with your therapist or the professionals you are working with, so we will have to go for regular evaluation. And if the child is stagnating, not able to pick up, or he's picking up very well, then we set our goals accordingly. We change it, we either increase it or decrease it for a period of time, and find out the reason why is the child stagnating, or if there is a regression, why it has happened. Okay, so monitoring and adaptation is very important. We cannot work on the same goal for a very long time without any adjustment. So we have to know the reason why this is happening. Okay, so next I will be talking about few techniques of parent mediated intervention. So prior to that, first I wanted to discuss about prompting. Okay, so when we start teaching a child, so we start with prompting. So there are various levels of prompt. So suppose for a child of 1 year of age, if you want, tell them two-step command, come on, go to mama and bring that ball, without using any gestures. He will not be able to do that, because that is not developmentally appropriate. A 1 year 12 months old child may start to follow commands with the gesture. If you ask him to give, he will give you the ball. If you ask him to go, give that to daddy, so he will be able to give that to daddy. So this is known as visual cues. So we are giving visual cues to the child, so which is a level of prompting. So we have to see what level of prompting does the child need to have a prompt to follow a command, or is he doing it without prompt? If without prompt, very good. If with prompting, then what is the level of prompt to be used? So for every child, we don't use hand on hand prompting. So if I want him to say bye, and if I am just doing like this and the child is imitating with my visual cues, then I will start from there, not going down to holding his hand and making him say bye. So if I have to hold the hand and say bye, then that is a full physical prompt. If I have to just give a touch over here, maybe, so this is known as a partial physical prompt. If by looking at my gesture the child is imitating, then it is a visual prompt that the child is following. If the child is saying bye only after response to my verbal instruction, then it's a verbal prompt. Okay, so this is the level of prompt we follow, always going from the highest one and then going to down to the lowest one. Like the lowest is the full physical prompt. So we will give that only when the child is not following the higher one. And when we start to prompt, the next day only we start to prompt fade. What does that mean? It means that I will not continue to give prompt throughout life for the child. Okay, and we will see, we will reassess maybe every 15 days, every month, that whether this much of prompt is required for the child or not. So today or a week, I have to give full physical prompt to the child for 5 out of 5 times of the activities that I tell him. Maybe next week I will try that at least 2 out of 5 times he should be doing without physical prompt, maybe with a lower level of prompt. And then prompt fading has to be started
Correct.
simultaneously. So this is the most important part of teaching that I wanted to discuss. Now, going on to examples of developing non-verbal and verbal imitations and communication skills. Okay, so we start with a lot of joint attention activities. So if I have to work on communication, specifically speech and language, there are various prerequisites for that. So what are the prerequisites to develop speech and language? So I cannot just sit a child with a child and directly teach him, okay, you look at the flashcard and you tell me the words. This is not possible unless the child is sitting, unless the child is looking towards me, joint attention, unless the child is looking at what I am pointing to. Okay, if these and definitely basic imitation skills should be there. If these things are present, then it becomes easier for us to teach a child. So for that, development of joint attention, imitation is the first thing. Sitting tolerance is what we work when we start working with a child, be it whatever age level that the child has. We start from the skill level of the child. Okay, so what are various joint attention activities? It helps us to develop eye contact, shared experiences, okay, using gestures. So play like peekaboo, okay, play like hide and seek, to and fro, play with a ball, or playing bat and ball with the child. Okay, so all these are, or maybe just highlighting your face by putting on some big this thing bindis, or maybe shining your a torch on your face, and the child should be looking at your face. So these are various activities which are known as joint attention activities, in which the child's attention is directed to the activity we are performing, or maybe to ourselves. Okay, Second is imitative play, encouraging the child to copy simple actions. When we talk about imitation, so it is not only action on objects. So maybe if I just hit a ball with a hammer, the child should be able to do that. If I'm patting the doll, the child should be able to do that. So this is action on object. If I'm maybe wiggling my ears, or maybe sticking out my tongue, the child should be able to perform that. So that is orofacial imitation. Okay. And then comes to gross motor imitation. So if I'm maybe doing some actions like wheels on a bus, or twinkle twinkle little star, or maybe I am just kicking a ball, or I am doing some actions like putting my hands up in the air. So gross motor imitation is again a part of imitative play. So when we are playing with the child, we encourage them to do all these simple actions. Again, how do we do that? We use various levels of prompts. So for example, for hitting the ball, if the child just looks at my hand and hits, then it is okay. Without any prompt, the child is doing. Or maybe if I have to hold the hands partially, then only the child is doing, then I will give partial physical prompt. So imitation, joint attention is the first thing that we target when we are working on the child. Next is modeling and prompting. Okay, so when we work with the child, so today only I was having a discussion with my behavioral therapist that it is not only activities that we make the child do. Language modeling, parallel talk is very, very important. When I'm playing with a doll, maybe, so I have to talk what I'm doing with the doll. Okay, so come on, I'm making the doll sleep now. I'm putting the bed sheet over the doll. Now the doll is hungry. Now let's feed the doll. So these kinds of modeling of language is very important. So we say that if the child is using no words, you at least start with one word. And with various intonations, so label every object that you see. So how we teach a 10 months old child? Okay, so how we say them, okay, come on, I'm applying soap to your body now. I'm trying to wipe you off. I'm pouring water. So same thing we have to do a child with a child who is non-verbal. Talking, modeling of language, parallel talk. If the child is using one single word, if he wants, suppose biscuit, he's saying Vicky. Then you use two words phrases. Oh, Vicky, you want biscuit? Want biscuit is the word that we use. Okay, so two word phrases for a child who is using single. So this way we go to a above level of the child's present speech level, and then we model the language for him. And prompting, for example, if the child if you show this child what is this, so we expect the child to answer this is a ball. Okay, so the child is not answering, then we can prompt this is a, and then you wait, you count 10 seconds in your head, you pause for some time, and then you let the child answer. Again, pausing is a very important thing. So when we are using prompting, so you don't always just rapidly give the answers, because many of the children will have delayed comprehension. So we wait, you count. So what I tell to the parents as a strategy is count 10, because we are in such a habit of always keeping on prompting or doing it for the child, so it's difficult for us to wait. So first we will have to learn waiting time, and then we are going to teach to the child. Okay, so it has always to be you count 10 in your head, and then you go ahead. Lastly is sensory based engagement. So children into the spectrum, and any children with neurodiversity, they may have various sensory regulation which is different from other neurotypical children. So they can be oversensitive to some of the sensory inputs, like suppose they are more hypersensitive to sounds, so they may not be able to tolerate the sound of a baby crying, or maybe small musical sounds also. Or some of them will be hyposensitive, so they want sense, they are into habit of getting sensation seeking behavior. They'll rub things over the body, or maybe they'll take things and put it into the mouth, or they will always like to touch other things, they will always prop up on something. So we need to first categorize or classify what are the sensory requirements for the child. So it's not a blanket therapy that we give. Okay, so it is to be again assess the child's sensory requirement is assessed in all the areas, and then we go ahead for it. And according to that, we can use various textures, various sounds, various movements. Coming on to movement, I always recommend that the child should have at least half an hour of physical activity in the morning and the evening, because that is something which will help us to regulate our senses. Okay, so this is very important, and free play is something which is very important. So for a 2.5 years old, if the whole day is structured and there is no time for free play, it becomes very difficult for him, because that is not something which is age appropriate or developmentally appropriate. So, and it is very important for free play, is very important for the child to develop his cognition. So always remembering that we should not overdo. If the child day is planned, at least 1 to 2 hours of free play time should be there, in which the child is actually able to do whatever he or she wants. Now, coming on to discussing some sensory diet strategies. So, as I was talking about sensory integration, so some strategies that can be there is, suppose, for example, if the child has sensation seeking behavior, so we can use deep pressure activities like maybe bear hug, weighted blankets, or compression clothing. Movement breaks should be given. If the child is not able to sit for maybe 20 minutes or 30 minutes for a very long time to concentrate, so we see that what is the maximum time the child concentrates. After that, we give them a break for movement. So we can keep trampolines, it can be some yoga poses that we are doing with the child. If it is 7 to 8 years of child, we can do some breathing strategies and then ask the child to come back. Oral sensory input, we can give chewy foods, chewy crunchies to the child. Tactile play, playing with the sand, rice beans, or water beads. Okay. Auditory regulation. So if a child is too sensitive, so there was a child who became very much agitated during the Diwali time because of the crackers. So we can just imagine the amount of pain and distress he must be in. So for them, we can use noise cancelling headphones. So to tell, most important thing is we cannot change everything. So in many of the scenarios, we have to modify the surroundings for the child to be comfortable. So earlier there were, when there were chains of big bazaars. So in Pune, one of the big bazaars and all, they had started time in which was a quiet period in which children who are into the spectrum or those who have sensory issues, they could come and they could shop easily. So because those have auditory regulation issues, they were very distressed when it was overcrowded or over noisy with all these things. I think many of the centers have also started. So definitely modification is something that we can do for the child. Again, proprioceptive activities, carrying groceries, pushing heavy objects, visual stimulation management using dim lighting or visual schedules. So all these things are some of the sensory strategies which can be incorporated in the child's daily routine for them to be regulated better. Now, most important is managing challenging behavior. So, when we go on to talking about behavioral issues, first thing that we keep in mind is every behavior has a reason. When a child shows any maladaptive behavior, there has to be reason. The child is trying to communicate something. So that what the need for the child is, what the interest of the child is, it has to be understood before we just go into managing the challenging behavior. For example, if the child is crying, so we have gone out for shopping and the child is crying, and we are still want us the shopping to be completed because we are in a hurry, but the child is hungry, so we have not adequately fed the child, or maybe the child is now bored, or the child wants to sleep. Because of that, the child baby is crying or the child is crying. So it is a need. So when two adults talk, if you see a child of 3 to 4 years, they'll come towards you, they will be doing something, maybe throw an object. Why? Because it's an attention seeking thing, they want our attention. Okay, so in this way, every child, every behavior has a reason. So first foremost thing is we ask the parents to maintain a behavior diary. So if my child is having a challenging behavior, so from day one I start to maintain a behavioral diary, which we mention the ABC. A stands for antecedent, B stands for behavior, and C is consequences. So antecedent means what happened before, prior to a behavior. So for example, my child started to hit me. So prior to behavior, what was the scenario? Was the child in a playful mode, was sitting and playing and suddenly came to hit me, or maybe he was crying and wanted to tell me something and I was not able to understand, and then the child hit me. Okay, so prior to that, what was the antecedent? what is the behavior seen, and then what are the consequences. So what did I do when my child hit me? Did I started to laugh, maybe in a playful way, or maybe others started to laugh, or maybe I just shouted back at the child? Did I hit the child back? Okay, so this is the way we maintain a diary to understand what is the reason, what is the function of that behavior. And then we use various strategies which are known as reinforcement. Okay, it can be positive or negative. So for example, if I ask my child to put a ball in the basket and he did it in the first time, then I applauded. So that is a positive reinforcement. So every time the child puts a ball, I am clapping. So my brain is registering that, okay, I receive appreciation. The child's brain registers that he is receiving appreciation when he throws a ball into the basket. So the behavior will increase. He will always do that to have a good sense of appreciation. Okay. Similarly, modification of environment. So as I told you, sometimes environment may be too sensory overwhelming for the child. So we have to modify it. So I have given a puzzle, 9 pieces puzzle to a 3 years old child, and the child is not able to solve that. The child starts to cry out of frustration. Okay, because I have given him an activity which is not developmentally appropriate. So what should I do? I should either break it into chunks, start from 2 piece or 3 piece puzzles. Maybe I can give additional help to the child. So okay, I have to modify the environment sometimes to for a reduction of behavioral challenges. And medical management. So sometimes, just to tell you, if the behavior is very worsening, if the child is involving into self-injurious behavior, self-harming behavior, or very much irritable, and this is impacting his functioning and learning, then for children into the spectrum, sometimes yes, there are FDA approved drugs which we use, medications which we use for a very short period of time, which does help to get good results, and it helps the child to become functional and reduce the negative behavior so that the learning improves. So that is the only use for medications for managing challenging behavior. So that is an option which we use in the extreme cases. But prior to that, understanding the challenging behavior is very important. Now, going on to activities of daily living. So, if my child is not speaking, if the child is not walking, if the child is not doing fine motor skills, has not a good cognition, I am not worried. I am more worried if the child is not able to do activities that a child of his age should be doing. Okay, so which is known as activity of daily living. So, for each age, in the next slide, if we see, so for each age, there is a defined skills
Ma'am,
that the
if you
child.
don't mind 1 second.
Yeah.
Ma'am, I think your PPT is not getting slide. It is in first slide only.
Okay, is it so?
Yes, ma'am. I missed it.
Okay, okay. I'll just.
You can hear enable editing, ma'am.
Mhm.
So that
Is it visible now? It's
yes,
moving.
ma'am. It's
Okay.
visible. Can you slide down one slide?
So, can you see the activities of daily living slide subtitle?
No, ma'am. It is changing. The slide is changing.
Okay, okay. I think it is going slower than, because I am already changing the slides. I am into activity
Okay.
of daily living right now. Still, it's the same slide.
Same slide only, ma'am.
Okay, okay. So, I think then maybe you can share from your side. I'll just do the talking.
Sure.
If it is not at all moving, or maybe I'll just try one more time,
Okay, okay, fine.
because I am almost this thing.
is now activities of daily
Correct.
living.
Yes,
Yes.
yes. Now, did it go to normal age range? Next slide.
No, mom, it is in activities of daily living only.
Okay.
Now it is changed to normal age range.
I think then I'll not enlarge it if it's okay, because I think when I'm making it full screen,
Okay.
so it is getting slower or something like
Yes,
that.
mom, we can able to see the
Huh.
letters clearly only.
Sure. Okay then. So now going ahead, as I was talking about the activities that a child should be performing age appropriately. So I have listed few. There are many more. But for example, for a 1 to 2 years old child, they should be able to walk unattended, feeding self with spoon. They should be able to scribble, pull pants and socks down, and drinking from an open cup and glass unassisted, indicating wet diaper, giving empty dishes to the adult. So as it goes age wise, every age has a different skills that the child should be able to perform, and it is general, it is like universal. It's not like it's only for a particular country or this thing. This is a very universal thing which children of each country everywhere should be able to perform. And just to deviate from the topic, when we are talking about development, it is not gender specific, it is not country specific. So we have seen, and various researches have been done overall, that all the development milestones more or less are achieved at the same age, irrespective of the country or irrespective of the gender of the child. Okay, so uh, now moving ahead, so suppose I want to teach a skill to my child, which is maybe putting a t-shirt. So what I do, so I will divide it into various steps. So for example, which is known as chaining. So for example, if I want to prepare the task analysis of putting on a t-shirt, so what will I do? First, I will divide it into 4 steps. So first step will be pulling the shirt over the head, then pushing right arm through the sleeve, pushing left arm through the sleeve, and pulling the shirt down to the waist. Okay, so I divide into 5 or 4 doable steps, and then I start to prompt the child. Okay, so maybe on the first day I put the shirt over the head and I waited whether the child is able to put it into the right hand or left hand or not. If the child is able to do all the 3 steps, maybe pulling down the waist I will be able to do, or this is known as forward chaining. Or maybe I can start from backward chaining also. So for example, I do all the first 3 steps if the child is very young or maybe the skills are not so good, and then I allow the child to pull down to the waist. So it gives them a confidence of task achievement, and this is very important to divide each task into a doable. So everything can be divided: hand washing, if it is bathing, if it is dressing, undressing. So everything can be divided into 4 or 5, 6 doable steps. We prompt the child for the first 3 steps for the first week, maybe for example, and then we let the child do the last step. So in the next week, I will let the child do second last and the last step. So in this way, we are the child is developing confidence and mastery over the steps as we go up. So by the time we finish, the child has mastered all the steps. Okay. So this is known as chaining, and this can be used for n number of teaching n number of activities of daily living. Next comes to using a visual schedule. So, what is a visual schedule? For us, suppose today, if first time I am going to the airport and I have never flied on a plane, and there will be a lot of anxiety. Okay, so I am going to a new place. I don't know what is going to happen. So, if I'm shown maybe the airport looks like this, you'll have to go there. You'll have to go to this counter, get these things and all. You have to put the luggage in here. So, I will be more into the anxiety will decrease. I will feel more into control. So similar thing happens for a child into the spectrum. Also, many a times, many of the children they have what is known as executive function deficit, which is the planning deficit. Again, if I have to do a certain task, so tomorrow morning I have to go to my office, and prior to that I have to go a temple, visit a temple also. So I will plan accordingly. I have to get a 15 minutes early. I have to do finish this task in this time, and then so that I will be able to reach at that place at a particular time. So this is known as planning. Now, if I have an executive function deficit, this planning becomes very difficult for me because I don't have that time thing. Like it is difficult for me to assess how much time and all I will require. So, and what step two is to be done when. So it helps us if the children are presented with what is known as a visual schedule. For example, there can be morning routine charts, there can be school schedule, there can be bedtime schedule. So it helps to, first of all, as I told, to reduce anxiety. It helps to encourage independence, and also it helps to in the transitions. If there is a new thing happening, so tomorrow I have to go to the school for the first time, a new class, many children will again become hyperactive, they'll show a lot of anxiety. But if I have been preparing him since the last 7 days for this new change, whom are you going to meet, how the class will look like, okay, who are the new friends that will be there, the anxiety will definitely decrease and the transition will become much easier. So here are few visual cues that can be there. So this one is for dressing, what are the steps, how to put the first one, how to put the second one. Then this is again divided into the first, second, third, and fourth task of dressing. This is for washing hand. As I was telling you, we can divide each part into steps. You can stick it near your wash basin, and you let the child do the steps by visual cues. This is about the morning routine. So children who are trained but they face difficulty in the maintaining the proper timeline, so this can be used. And as I told, this is not specific for the children of autism spectrum only, but any child with neurodiversity. In fact, if with every children these things works much better, whether it be a neurotypical or a neurodiverse child. So it can be utilized in n number of situations. Okay, again, this is a time for nighttime routine. So what are the challenges? So why not everyone is going for a parent mediated training sessions, you know? So there are few things which we as a professional we sometimes face difficulty. So first thing is time commitment from the parents. If both parents are working, plus there is additional course that is there for the parents to do, so there is no time to engage, so it becomes inconsistent. So consistency is the key here when we are talking about early intervention. So if it is inconsistent, today I did some strategies, tomorrow I'm not following it, the child will take a lot of time to learn and the mastery of the skill will not happen. Okay. And definitely parent mediated intervention has to be supervised, because with the timeline, with the goal, as I told you, each thing changes. I cannot work on the same goal for 6 months and say the child is not achieving this or the child has only achieved this. So it is changing. It is we have to update our training and our goals as the time goes by. Okay. And each child is different, so there is not a blanket therapy that can be provided, a blanket training to the parent and you start working with the child. So that is why the child needs to be assessed first. We have to see the child's strength, we have to see the child's difficulty. So for example, if the child is cognitively very good, but only problem is in the communication and socialization, so I will put my efforts more. And because he is cognitively very good, I can use various strategies which are age appropriate and more than his age also sometimes, so to improve all these skills. So my strategies changes as the level and skills of the child changes, and definitely my timeline changes. So each child is different. And definitely there was a talk by one of our very esteemed neurodevelopmental pediatricians, so who reminded us that we cannot pour from an empty cup. So definitely managing parental stress. So if you are the only person working with the child, so for example, if I'm a working person and everything is upon me, I have to household chores, I have to do work with the child, I have to go to office, I have to earn for the families, everything, it becomes too much for me to handle. So sometimes taking again professionals input is very important. Maybe if at least twice or thrice a week his child is going to an intervention place, so it becomes easier. So because we get time for us to manage our emotional well-being also and parental stress also. So always when you as a parent, you are working with the child, take care of yourself. That is the first thing to be done. Okay. So please take out at least 15 minutes of time every day, and you please work on yourself, be it yoga, be it meditation, be it listening to loud music, just dancing with your child. So anything that can help you to de-stress yourself, then and then only we can do the best for our children. Otherwise it becomes very difficult when we are also stressed, so all the stress comes out upon the child only. And definitely if we start working with the child, there's a lot of improvement. We see that when the parents are also working along with the therapist or interventionist, and we do get tremendous results. So all the best to you. And definitely we are planning to start a formal parent training program, which we already have in our centers. So we are planning to do it both online and offline mode. And please do reach out. Please keep in contact. And this is my email ID and contact number. You can follow me on Insta at this address. And definitely the Ankura team will be updating you about a regular this thing. You can join our Ankura LinkedIn page as well and follow them up for any parent training sessions, which is almost free of cost that we do. And we will also like to have inputs from your side, because definitely as I always say, when I am talking, I am looking forward to learn something, at least one thing from my talk, from the parents or the person whom I am training. Thank you very much for the patient listening. Then I open the platform for questions.
Thank you, ma'am, for your valuable insights. Any question you can tell.
So if anyone has any questions, please you can put on the chat box. Is anything there? I think I just see that one question.
Yes, ma'am, is there? Is there any CDC at Ankura hospitals? Yes, we are having CDC.
Yeah. So if you can be specific about any branch, we'll be able to tell you more. Otherwise, please do contact. Uh, okay, so I see Mr. Kushore has posted a question. My kid is 5.6 years. So is there any specific concern that you have, Mr. Kishore, regarding your child?
Hand biting and head banging and
Hi,
everything.
ma'am. My name is Kishore.
Yes, yes.
Yeah, actually, my child was 5.6 years.
Mm-hmm.
So, currently, they are going to therapies,
Mm-hmm.
and there is no speech also, and head banging and head banging and hand also biting for the time.
Mm-hmm. Okay.
This is-
Can you
and
tell me more about the scenario? Like, is it why does he do that? Is he when he wants something, does he do that, or whenever you say no to something, is he doing that out of anger? Can you tell
yeah,
me?
the hyperactive is there. Some behavior issues is there, these are the main things: head banging and hand biting and head banging is there.
Mm-hmm.
Whenever is irritating now, more irritating. Whenever they want food now, there is no speech there, so they want for that time is head banging and hand biting is there.
Mm-hmm. Okay. Mr. Kishore, like if there's no speech, how does he communicate? Does he use his gestures or something to communicate?
No, no. So they suppose they want food now. We are understanding. They will give the food that time only. Okay, only they keep quiet for that time only.
Mhm. So what we see, first thing first is what I will say is a child who has no speech till 5.6 years. So definitely that is contributing more to the maladaptive behavior, because as I told you, need expression of need is very important. You know, so if the child wants something as is not able to express it, so generally they will say, if they don't want anything, oh do, and no, I don't want this. So if the child is already not able to speak this also, then it becomes difficult. Okay, so first thing first is what I will suggest is, if the child is not speaking in a conventional way, please do go in to start him on assisted this thing training such as Avaz and all. You can contact us. Where do you stay, Mr. Kashore?
Near Nijampet, near
Okay,
KPH.
okay, okay. So we have this thing. We have our team has Avas trained professionals. We can start him on that as well. And we need to move ahead further. We need to further analyze. So as I told you, please start maintaining a diary before you come to us on the scenarios on which why he is head banging and hand biting. So again, is it out of frustration because he is not able to express, the demands are not getting met? So all these things are very very important, because it is not only the behavior. We cannot just putting these things restrain on him is not going to work. We need to work on ourselves also. Like for example, irritability, as you told about. So why is he getting irritable? You know.
Yeah,
So
yeah,
what we will do is we will try to understand his behavior. Please start him on Avas training. Okay, you can contact our branch and we will start him on that as well. And third thing is, if it is very very severe, like self injury leading to means bleeding or this thing and all, then last resort is we may plan to start him on some medication as well, I was talking about. Okay, we will go step by step, but definitely working on expression is very important. You know? So if the child is not speaking in a normal verbal way, we have to give him some assistance till he starts to speak. Okay.
okay, okay, ma'am.
Yeah. Okay.
Okay, I will contact with
Sure.
our
Sure.
branch.
Yeah. Thank you.
Mom, we got
Thanks.
one more question, Mom. Sushant Kumar. Hi, Mom. My son is 4 plus. His hyperactivity is high. He has speech but no spontaneous. Should we polite to deal or command control during his hyperactivity?
Mhm. No, so always it has to be like again the hyperactivity to deal with that in a 4 years old child. Generally, they will be like not very calm and quiet. You know. So first thing is, please try to see whether how is the schedule of the child. Again, as I was talking about, is throughout the day he is expected to sit at a place and work. Is he getting enough amount of physical activities? So you can try increasing the physical activities, because that itself will calm him down. Okay, so you can enroll him in swimming or maybe jogging, cycling, whatever the child likes. And we have to always maintain our boundaries, but we have to be polite in a respectful way. So again, we will have to see the reason for hyperactivity, like what does he do. If you can, if you are there, if you can tell me an example or two of the behavior that he shows hyperactivity. Does he jump, does he run around, then I will be able to help you better. Mr. Sushant, are you there?
Yes, ma'am.
Yeah. So can you tell me more
Actually,
about it?
many times he, trying to jump here and there
Hmm.
from high to, top to that bottom, like this. And
Hmm.
in night time, his physical activities become high than daytimes.
Hmm. Does
Uh,
he have a
we
lot of
thought.
screen time? Hmm.
We thought he got their parents during night time only.
Hmm.
So he may prefer used to play more. That may be.
Hmm. So does he have a high screen time also? Screen time is very high for him.
No, 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 not actually.
Sleep is good. He
Actually,
sleeps well.
sleep. Actually, see, he always prefer late night sleep. He slept around 1 p.m. 2 p.m.
Oh,
So
okay.
then that's a problem.
Hmm.
Mm.
And what is the amount of physical activity that he has throughout the day?
Uh, he's going to therapy also. Apart
Hmm.
from that, in our room, sometimes he politely or very coolly play those things when he got free play times.
Hmm.
But sometimes he prefers to, the activities like jump,
Hmm.
getting, lowering her head down and put straight. This
Hmm.
kind of activities. Uh,
Hmm. Okay, so what we can do regarding this is, if the hyperactivity is more in the evening, so make sure that he gets at least half an hour to 1 hour of physical activity time during the evening. So maybe taking him out to the playground or leaving him for a free play again, whatever he likes. If it's cycling, if it's jogging, running, and all, please let him do that, and it should be like an exercise. Second thing is, you can start following some sensory strategies before sleep. What we call it as a sleep hygiene. So like at night, make sure that he goes to the bed by 10, and prior to that keep a fixed routine. So there should be a fixed sleeping time, fixed wake up time. Prior to sleep, definitely washing hands and legs, or maybe some sort of a oil massage or a deep pressure massage kind of thing, changing the clothes, so that every day the routine is same. Okay, and definitely no screen time at least 1 hour prior to the or maybe too much of activities 1 hour prior to the sleeping time. So these are the basic
okay.
things that we do, you know. And see, any behavior changes will take time. So if you follow this consistently for at least 1 to 2 months, definitely there will be changes. Still, if it is not happening, then we will see what is the reason. But I think if you follow these strategies, it will be better, because just stopping the behavior will not help. We will need to give some outlet to his energy. If he has high energy, we need to increase the
Yes, sir.
amount of this thing. Give him opportunity to release it
Yes.
during the appropriate areas. Okay,
Okay, thank you.
thank you.
We got one more question. Ma'am.
Excuse me, ma'am.
Yeah,
Yeah.
Excuse me, ma'am.
yeah, please tell.
How to give the toilet training, ma'am? Toilet and washroom.
How old is the child?
The child is 5 years old, ma'am.
Okay, okay. And does he indicate wet diapers? And how is the speech skills? How much is the speech for the child?
He's talking all the words, ma'am.
Mm-hmm. Okay, so is there a specific word that you use for toilet, maybe potty or susu kind of thing?
No, ma'am. She's not using anything, ma'am. But she's doing every time in one place only, ma'am.
Mm-hmm. Okay, okay. So
If
what is the? Yeah, tell
she
me.
gets the toilet or washroom, sometimes she's going to the washroom, ma'am.
Mm-hmm. Okay,
She
okay.
get toilet, she's going to the washroom and going and come, ma'am. But she's getting the washroom means she's not going, ma'am. She's going outside only, ma'am. She's not sitting in the toilet, ma'am.
Mm-hmm. Okay,
What
okay.
happened? I don't know. Ma'am. This 1 hour, 2 hours also I'm sitting with her, but she's not doing in the
Mm-hmm.
toilet. She's
Mm-hmm.
doing outside only, but toilet she's doing in the washroom.
Mm-hmm. But she
Washroom
sit.
are in front of the washroom.
Okay, okay, okay,
She's
okay.
she's doing the clothes outside and going to the washroom and completing the toilet and coming out. But
Mm-hmm.
the washroom she is not doing like that, ma'am.
So 2 to 3 strategies here we use. First thing is you maintain a chart of the most important time that she is very means she goes to the washroom, in the sense, like, suppose after eating food, after eating lunch. So what is the most common time that she goes over there? So at that time, try to take her and make her sit in the toilet, and try to engage her into something like maybe reading a book or something, but not very long. If she does it in within 5 to 10 minutes, good. Then you can come back. So what must have happened is she has developed that association of that particular area where she does the washroom with the this thing area and toilet association that is there. So what we do is, first thing first is making a timeline, a schedule for the child, which is the most common. Like, this time she'll go for urine, this time she's supposed to go for motion. Every 3 to 4 hours you take her over there. But because she's toilet trained, make her sit at the most common, most probable time of passing washroom. That is the most important thing. And third thing is, you can show her visual pictures. So what we call it as a social stories, as I showed you for dressing and all those things. So you can show her pictures of that like potty should be done in this washroom only.
Yes,
So
ma'am,
there
I'm
are.
showing that, ma'am,
Mhm.
but she is
Okay,
doing like that, ma'am.
okay. How long has
One
have
hour
you been
also I'm
doing that?
sitting with her, but she is not doing, ma'am,
No, no, don't
for
sit for one
washroom.
hour. So it's okay. 10 minutes is fine, and you bring her back. Okay. So what happens is, the most probable time that she is passing is the most important thing. Where when she gets the urge. So if she doesn't have the urge, she will not pass. That is the most important thing. And second thing is, consistency is the key. So consistency means, if you if you are working on that toilet thing, like showing her pictures and all, how long have you been doing that?
Yes, ma'am.
I mean, so how long? Like, did you show her picture for a week or a month kind of thing?
In YouTube, when she's watching the videos, I'm giving that one, ma'am. The
Okay,
potty
okay.
training videos. I'm putting her in the potty training videos, ma'am. She's watching, ma'am, but she's not doing, ma'am. Hello?
Hello, 1 second.
Yeah, sorry, I got logged out.
Sorry, you were saying that in YouTube, you were giving her videos of that thing, na? Potty training thing. Are you still there?
Hello.
Yeah, yeah. Hello, Sailata, am I audible, right?
Yes, yes, you are audible, ma'am.
Acha, acha. I think.
Hi, ma'am. I have one question, ma'am. Sure.
Yeah, please go ahead.
Actually, head banging and hand betting and head banging, there is a behavior issues, ma'am, for the hyperactive for that one.
No, see, it is a behavioral issue. So the child is showing the behavior. So it may be an escape behavior issues, like if the child suppose doesn't want to do an activity and he headbangs and then you are taking him away from that activity. Or it
Yeah,
can be a,
yeah, last 3 months we are going to the therapy, ma'am. But whenever playing, he's going to bed. He's aware. He's playing to. He's going to play, but he's going to bed for that one.
acha, acha. Means during the playway only he is doing the head banging. Is it so?
Irritating whenever he wants to food. That time only is irritating. How to say that he don't know now how to he want food.
Exactly,
Some
exactly.
irritating, some hyperactive. That time only they're behaving like that. That normal time
Okay.
they continuously is walking, sitting, and playing. That is there. But only for a day, only 2-3 times only is head banging and hand biting is there.
Yeah, so that's what this is more important. I think the answer to your question will be to help him with the speech in whatever way, because unless that is there, it is difficult. You know? So till that time, what you can do, just see that if it is in response to food, suppose if he is hungry, so maybe just before he becomes too hungry, prior to that only you can offer him food, like scheduling the time of food. But I think once he learns a way to express it, it will be helpful for him.
Okay, ma'am.
Hello, madam. Good evening.
Yeah, good evening. Please tell me.
Please allow me for a couple of doubts.
Sure.
Actually, there is so much restriction for the foods we give to the kids, autistic kids, and many foods my child is so much fond of are being very much restricted according to the therapy center. And they are very much fond of snacks. How we can meet this challenge of snacks? Because that will be a very irritating concept, because a lot of foods are being avoided and very less we give them. So how can
Correct.
we do that?
Can you tell me what are the foods that you are avoiding that your child likes?
Actually, all the gluten products and dairy products are being avoided, and most of the snacks come from that. And due to some gut issues, sometimes we even prevent these deep fried items, all that. And we actually see very few lists that can be provided. So how to meet this challenge?
See, if and since when are you following gluten-free, casein-free diet for the child?
Yeah, ma'am.
You are following this diet restriction from how long?
From almost 2-3 months, ma'am. We are
Okay,
strictly said from the therapy center, so we strictly prohibited from 2-3 months.
Okay, and how long? How old is your child?
Now he is 6 running.
Okay, fine. See, the thing
Sujit
is,
Sai, ma'am.
first,
You might be familiar. Sujit Sai.
Yes. Of course. Yes. Yeah. See, the thing is, gluten-free, casein-free diet, gluten comes in only wheat and its associated products. Okay, so wheat, anything made from wheat, maida should be avoided. But you can use multigrains, right? There is no problem in that. You can use corn, you can use like snacks. If he likes, you can make something out of the multigrains and all. Millets can be used. It doesn't contain gluten. So millets can be used to prepare. So you get a lot of things like ragi puffs and all nowadays. So that can be used. That's fine, absolutely.
And regarding the fruit, ma'am, fruits also, most of the fruits are being
There is
avoided.
no research that says that fruits eating can cause, like, there is no research paper on that. So just blindly, I don't this thing. I don't prefer just blindly avoiding fruits because there is no research backing that. Gluten free, casein free, yes. some evidence, so we can give a trial for 6 months to 1 year, but not with respect to fruits. So from my side, I never stop giving fruits.
Okay, thank you. Thank you. It's a good thing to hear, ma'am. And one more thing, almost from 2 years for my kid, we are running after therapy centers. We changed almost 3 centers. And we are spending a very huge amount on that. And the thing is how to interpret this, see the results what we get, and how as the parents will be so much curious to know how our kid is improving, how is there really a developmental side or not. All that we can't daily go on and talk with the therapist. Actually, how to interpret these results, whether we are getting good results and we should trust them or not, all that.
The most important thing is functional independence. So what we talk about is if the child is able to do the activities what he was intended to do, as I was talking about activity of daily living. So that is the first and foremost thing that should be targeted. Second thing is reduction of maladaptive behavior. So if the child was showing very severe behavioral issues and now the child is improving day by day, then that is again a sign. Okay. And then development of some kind of communication skill, be it verbal, be it speech wise, be it non-verbal. So if these parameters are being seen, so then definitely, but it takes time. So you can give a 3 to 6 months time and see. And that's why I was talking about goals. So if the child is, they have given you a goals, and then if the goal is being achieved in 3 to 6 months, then that means definitely there is improvement. So ask them to share the goals with you, and then you will be in a better position to understand what they are working on.
Okay, goal depending on definitely time period. It's not goal that we can wait for a long time. Definitely the goal should be time dependent, I think.
Exactly, yeah. So they means suppose a therapist is working with the child, so they set like, okay, in 1 month I am targeting this, in 3 months I am targeting this, so that you can discuss. So that is not a day to day. Also, it will take time, and then you can see.
Okay, sure, ma'am. Thank you, ma'am. Thanks a lot.
Thank you.
We got one question, ma'am. My kid is 4 years old, showing sensory issues like he putting his fingers in his mouth and then rubbing the fingers on his face. How should I help regulate the sensory issue?
Okay. So two things are there. One thing is it that he wants that saliva to come out and rub on his face? That's why he's mouthing, or both the things are there, that he likes to mouth and chew the objects, as well as there is rubbing over the face also. So because if only mouthing is present, mouthing is the problem, and so we can use various kind of vibrating brushes, or there will be Z wipes, known as Z wipes, so which can be used for oral manipulation of the child, exercise kind of thing. And you can give him a lot of, because it is a sensation seeking behavior. So if the child might be liking something which is slimy to touch, so you can allow him to play with a lot of creams, or maybe the lotions kind of thing. You can allow him to maybe wash his face with soap or something like that for around 1 to 2 times per day. So giving him appropriate things to decrease his sensation seeking behavior is what I see will work in this situation. And along with that, some oromotor stimulation will also help.
Okay, ma'am. Thank you.
We got one more question. Can you suggest any physical hobbies that can help with sensory issues?
Yeah, so physical exercise, if again it will be age appropriate. If the child is 3 to 4 years old, then you can keep a trampoline at your home also for them to jump on, or it can be some kind of movement exercises, what we call it as. So there will be various yoga poses for the child that can be done, or simple playing in the playground, going on the slide, going on the this thing, monkey bars and all that are there. Simple jogging, simple cycling. Swimming is a very, very good physical activity because it gives that sensory feedback to the water, gives the sensory feedback to the child as well. So these are the basic things you can, if he's following a bit of commands, so enrolling him in some things like karate and all is also good.
We are having one more question. My child is 4.4 years old. He's going a speech behavior and occupational therapy from last 2 months. We stopped the screen time. He used to have to 5 hours screening time. What can be done more? How many months he need therapy? He don't know, ask anything, he don't talk. My child
See,
eat
it is
only soft food. He don't chew the food. He eat only rice and curries.
Okay. So, to answer the first question, 4.4 years and the child is having no speech, and I assume that no other methods of communication also, like using gestures and all. So it's good that you are taking the all the sessions like pointing, but it is a long process, as I always tell, because 4.4 and no speech means his speech level must be somewhere around max 12 months to 18 months, that I am assuming. So to cover up at that gap also, it takes time. Okay, so what else can be done is please work on all the skills that they are working at your home also. So for example, today if they are working on sitting tolerance, or maybe they are working on color matching, picture matching, sorting. So involve the child in daily activities with you at home. Okay, so you can just ask, give him simple commands like, come on, put this thing into the dustbin, put it into the open clothes into particular basket. Labeling everything. I was talking about modeling and all. You know? So if they are working on color matching and sorting, you can ask him to sort utensils. You can ask him to sort the vegetables. So it helps in generalization of the skill. So what the child is learning in a room in a therapy center, it helps him to generalize it outside of the therapy room also in a meaningful way. Okay, so that is that you as a parent can do. And to answer the question of the second one, eating soft food only. So the answer to this is again exposure. So what we do is we try to increase the texture and make it more chewy or crunchy very gradually, day by day. So one thing at a time, maybe one food at a time that we introduce, and then we allow the child to be sensitive or maybe develop tolerance to those senses. It's a time-taking process, but yes, it will be definitely it will the children outgrows by this soft eating food and all those sensory behavior that is there.
Any questions?
I think that was the last one.
Yes, ma'am. That's the last one.
Hi, ma'am.
Yeah, please go ahead.
Ma'am, my daughter is 5 years old.
Mm-hmm.
At 4.5 years, we potty trained her and she's doing potty in the bathroom. But since from the last 1 month, she's not doing, she's doing in the clothes only.
Okay.
Earlier, we used to train her. I used to tell her that she used to go to bathroom. Earlier, she was fine, but recently we took her to the hospital for the assessment. We haven't started therapy till now. During assessment and during hospital visits, at the time only she is not doing the potty. She's again back to the doing in the clothes. Is it any fear that she is facing while going to the hospitals and all?
Okay, fine. See, any stressor that is there may lead to or any change in the child's schedule. The children, many of them, they show this regressive behavior that they have learned a particular behavior, then they'll go back. Any change in any other areas that you see that the child has become more fearful or maybe is not
No,
understanding, is not working?
earlier she used to have a screen time 1 to 1.5 hours. We reduced it to around 10 minutes, 15 minutes.
Okay, fine. So any change can this thing incorporate this kind of changes and bring back the regressive things in the child. But I think you be consistent, nothing to be, don't punish her, don't reprimand her for this thing. You again go back to training her to the normal potty situation. You know? And is there any excessive constipation or something that is there?
No.
No constipation, like no loose motions, nothing that is. I think it's just a matter of time. Any child, even other children's also, they may face this issue, accidental pudding. You just go back to your usual training again. I think in another 1 to 2 months, she should pick up because she was already doing it. It is a stressor that has predisposed to this. So please go back to your usual training. She will definitely pick up. Nothing to be worried about it.
Okay, but now we are looking at the hospitals, looking for the therapist. I was overwhelmed what the therapists are saying. I was very confused to choose the therapy center and the hospital also. Someone is saying occupational therapy, someone is saying speech therapy. So I couldn't figure out where can I take my child to.
Okay, zero down to a center. So see, the center thing will be, first thing is something which is accessible for you, closer, nearby. Definitely finances is one thing that you need to see. Third thing is there should be open door policy, you know. So what we follow in our center also, like the parents are also invited. There is a CCTV camera that is there, so that at least you can see what is ongoing. There are regular parent training, and you should know what the thing is going with the child. Okay, and the therapist and everyone should be properly qualified and RCI certified. If all these criterias are there, then you can choose. You know, these are the basic things. Otherwise, if the trained therapist, means their skills will be present, plus and minus, and which therapy to choose depends upon the child's skill. So that is the most important thing. Present level, as I was talking about. So depending upon that and what are the issues, then only it is possible to decide whether only behavioral or OT will be required or speech will also be required, kind of thing.
Okay, so that's the reason I'm asking, is there any CDC at Ankura Hospital I want to visit?
Yeah, we have CDC at 3 to 4 branches. Okay, so where do you stay? Depending upon that, you can contact and you can get the information. You know? So we have at 𝐺𝐳, Madinaguda, we have at LB Nagar, Uppal. Okay, so KBHB. Yeah, so all these areas are having.
Okay, ma'am. Thank you so much, ma'am.
So one more question I see, is there any insurance coverage for therapy? So yes, what happens is the many IT companies, when they are giving that Medi-Assist, the group insurance, no? In that there are provisions for providing therapy sessions coverage also. So you will have to check with your HR, and many parents have applied for that, and we see even the company is also like helping them out. So maybe you can reach out to your HR and we can provide the proper document. Like we give here, what we do is we give a letter along with the assessment report, and that is accepted by many companies. They are providing it. So the private insurance does not cover it as of now, but yes, the group ones which is provided by the company, they may cover it. So it is better to see your policy documents and then to provide like talk to your HR also of the company.
Yeah, good evening, ma'am. Actually, I tried to claim, but it was like a decline due to it was not part of when they are negotiating in between vendors, right? That time they are including those diseases. So I've applied, but they're rejected because while the time of the negotiations, that disease is not covered. So that is the reason we are not going to be proceed approval part. They said.
So this was the company's one. Acha, acha. This was a company one, the Medi-Assist one, or a private insurance that you are talking about?
No. A company one and Medi-Assist.
Medi-Assist. Okay.
I asked them why other parents they have claimed it. Other inside other employee might they are include their diseases in their company. That is the covered. And apart from that, they have asking what to say discharge summary as well. So discharge summary it is ongoing process, right? That is the reason we were not able to provide. But anyhow, if it is not list down that, then definitely it's not going to be approved. I've tried couple of times, but it was.
So maybe when you are applying for like every year, the renewal is there, no? So at that time you can check again if there is some extra premium to be paid and that gets included. So that can be done maybe. Once you are renewing your policy the next year, you can check and you can then include that disease as well. So maybe then it will be helpful.
Okay.
Any other questions?
I think that was the last question.
Yes, ma'am. That's what.
Okay. Thank you, Tari. Thank you very much, everyone, for joining in. And we will just, if you have any queries, please contact our team and we will guide you. We will try to help you out in the best possible way. Thank you.
Thank you all. Thank you, ma'am. Thank you for valuable insights. Thank you, ma'am.
Thank you, madam, for giving insight. Thank you.
Thank you. Thank you.
Thank you.
Thank you for joining. Thank you.
Thank you, ma'am.
Thank you.